We want to provide you an update on our mobile crisis response teams. I think this is a transformative program, and we brought the action forward in 2020 to take this county-wide and provide an option for individuals who are in a state of crisis and individuals who are suffering from mental health or substance abuse to be able to have a trained clinician show up to provide you help. A driving force in everything we do is getting the right care to the right person at the right time. And we know that law enforcement sometimes has to be the responding entity if the individual is a danger to themselves or someone else. But a lot of these folks are not a danger to themselves or someone else. And in that case, we want somebody like the people you see standing here behind me. Trained clinicians, peer support specialists, folks with lived experience, folks who have the time, the compassion, the empathy, the expertise to be able to help get these individuals into the right place. And so we want to provide a report and an update for you all today, along with sharing some of the new public education campaign to let San Diegans know this is a resource that is available to them and their families. But it isn't just a program or a public education campaign or a number. This is about taking care of one another. And I would venture to say that every single one of us knows someone in our lives who has been impacted by mental health injury or by substance abuse issues. Maybe a friend, a coworker, an aunt or uncle, maybe us ourselves. Could be a coworker suffering with anxiety, a veteran suffering from post-traumatic stress. It could be the unsheltered individual out on the streets who has accumulated a lifetime of trauma and addiction. But these are the individuals that we are trying to match with the right care and the right service in the right way. Just like if you are having a heart attack or in diabetic shock, we send medical folks to provide you the help and assistance. We want to do the same for individuals that are suffering from mental health or substance abuse. And mobile crisis response teams are a foundation of a better way to get someone into our system. But it's not just about changing the entry point when they come into our care, it's about changing their overall trajectory. It's about getting them into the most appropriate level of care and then providing ongoing help and service as we go forward. And so we are excited. We now have 16 teams spread out across the county that are ready to respond. 2 incredible providers who are here, and a lot of incredible individuals I had the chance to talk to a little bit who are out doing this vitally important work. Since February of last year, more than 672 clients have been referred to MCRT. That includes 51 referrals from National City and Chula Vista police departments. Those 2 cities now have this integrated into the 911 process, meaning as a call comes into 911, that 911 dispatcher can triage it, can make an assessment about does this need to be a law enforcement response or an MCRT response. We are working with the other law enforcement jurisdictions to get that same system in place, and we believe that soon that will happen. But out of the individuals we've responded to today, 112 have been linked to treatment services. These were people not connected to treatment previously. 47% of the referrals have responded to has resulted in the individual being able to remain in the community without the need for law enforcement or more acute services, a real on-site service that they can provide. And approximately 20% of the referrals have been individuals who are homeless or unsheltered. But it is not just a program for the unsheltered. This is a parent who may be struggling with a child who's having some real anxiety or mental health issues. It's anybody. It is available to anyone who's out there. And so we are very pleased with the direction it's going. We are grateful for the speed by government standards at which this got stood up and executed. And at a time when there is a critical shortage of behavioral health workers, we are really proud of these workers who go out every single day and encounter some of the most difficult challenges you could face and do. So as we move forward, we're obviously working with the other law enforcement jurisdictions to get those integrated into 911. But a lot of the referrals now come from our Access and Crisis line. And San Diegans right now can call the Access and Crisis line, and MCRT can be dispatched from there. And a part of our public awareness campaign, which you'll hear about from a minute, is to raise awareness of the option for this. And so again, I want to thank everyone who is involved. I want to thank everyone who has helped us create something fundamentally new, a completely different approach, which meant new contracts and new vehicles and new staff and new protocols and new procedures. And as we go through the future, as we assess this on an almost daily basis, there invariably will have to be changes that have to be made. More support provided, things changed. but we wanted to move with a sense of urgency, recognizing how urgent the need is. And so we're thrilled to have this up. We're thrilled to announce the public awareness campaign and thank all of our workers who are involved.